I would like to introduce Malycki, who graduated with a Bachelor's of Arts in Spanish Language and Literature, Political Pre-Law, and International Studies and Relations from Loras College in 2021. His energy, passion, and optimism have made him a focal point in a hope of building a more profound, meaningful connections with the lesbian, gay, bisexual, transgender, and queer, or LGBTQ plus community in rural Iowa and also among BIPOC populations in the Midwest. Before One Iowa, Malycki was a health literacy advocate for the migrant and refugee communities of Eastern Iowa. Malycki, welcome to the stage. Here's your clicker and there's your slides. Awesome.
Hey y'all, my name is Malycki Mañon-Sosa. I am the program coordinator at One Iowa. If you're unfamiliar with what One Iowa is, I'll tell you all shortly. But that being said, I'm also a strong believer that representation matters. So I always like to disclose that I'm a proud Afro-Latino. If you don't know what that means I'm Black and Latin identifying cisgender man from a small town called Calmus, Iowa. To give you an estimate there, I really related to the individual in the video saying that they had about 300 folks in their hometown in Iowa. Same. So that being said, I have a pretty diverse outlook on what's going on here in our state, especially being from such a small rural community. I saw the lack of resources for folks that looked like me, that had identities like me, but also folks who were different from me, right? But then also different from the small population that was there in rural Iowa. So that being said, I'm here to talk to you all today about LGBTQ health in Iowa, specifically the 2021 Iowa LGBTQ Health Needs Assessment. So before any major presentation that One Iowa does, we do what's called a land declaration, and this is declaring the native and indigenous stolen land that I reside on. You might be wondering, Malycki, what does this have to do with what you're talking about today? It actually has a lot to do with what I'm talking about today when we're talking about native and indigenous folks. So if you want to learn more, I invite you to do so by reaching out to One Iowa. But that being said, I always like to disclose that I live in West Des Moines, Iowa. So I reside on the Iowa, Lakota, Dakota, and Meskwaki Native and Indigenous tribes lands. So then, right, who are we, right? We are One Iowa. We are a small but mighty team of 5 representing the entirety of Iowa when we're talking about the LGBTQ population. So we were founded in 2006 working towards marriage equality, and then in 2009 when that became law of land, we shifted internally and said, do LGBTQ folks still need us? Surprise, the answer was yes, it's 2022. And so we've been working diligently in general advocacy for the LGBTQ population here in our state since that time. So that being said, we have a long history of work that we've done in our state. And that being said, we focus our general advocacy efforts on the 3 areas that you see on your screen, and then you'll see resourcing as well. So we focus on healthcare access. Today, we're going to be talking a lot about healthcare access and the barriers that our community faces and the outcomes or findings that we found in our survey to kind of give you a reason why we focus on that as an organization. Then we also focus in leadership empowerment, right? We believe, right, 5 people cannot represent an entire state of LGBTQ folks. So we're all about finding great LGBTQ leaders throughout our state, lifting them up, giving them resources to continue doing their great work, but be even better leaders, right? So that way they can do the work that we're hoping to do in their own community. Then workplace culture, we're all about going into organizations saying, hey, here's what LGBTQ folks experience, here's why it matters, here's why you should care, and here's what you can do to make things better. So if you're interested in that, again, please reach out to us. But that being said, we also do a lot of resourcing, making sure everyone in our state has everything that they need to live a happy and healthy life. So let's see here. Whoa. Awesome. So, right, I can't be here talking to you today about our health needs assessment if you truly don't know what that is. So, our 2021 Iowa Health Needs Assessment was a comprehensive survey that was looking at a variety of health topics specific to our community. And it was the first state-funded needs assessment that looked specifically at the LGBTQ community. There were a few other surveys that went live in our state in previous years that looked at LGBTQ health. I always like to shout out other previous work done by great people in the field. So shouting out Des Moines University and the University of Iowa, specifically Dr. Paul Gilbert at the University of Iowa, who was looking at LGBTQ health before myself and the lovely folks at IHHS were formerly known as IDPH. So, right, how did this begin? How did we get started to look at the broader picture of LGBTQ health in our state? So it all started with one of those great grants that Dr. Richardson talked about earlier, a CDC grant received by the tobacco division specifically at IDPH. And so they decided, we're going to choose a local lead agency to get onto this grant and work together in collaboration. So they obviously chose one Iowa. And so we decided, what do we do from there, right? Specifically talking to folks at the Iowa Department of Public Health, we were like, where do we go? What are we talking about specifically when we're talking about tobacco control in the LGBTQ community? And we decided, what? We might need to understand the community a little bit better to start working in tobacco prevention efforts for our community, right? So that was kind of the first step there in our process. So then you'll see the LGBTQ National Cancer Network, which is a CDC org. So that being said, they've provided a great plethora of resources to One Iowa and IDPH in conjunction when we're talking about planning this survey. So the great folks at the LGBTQ National Cancer Network put us in touch with some folks in Pennsylvania, right? Why rebuild the wheel if it already exists? So some folks in Pennsylvania had already done some great surveying as well and said, hey, we have this tool and all these questions we asked, and we have some best practices, some tips for you all, and they really helped us get started here in our state to do this amazing work. So again, always wanting to shout out folks who were doing this work before I. So the timeline of it all, right, once we kind of got that instrument and tool established from the folks in Pennsylvania, we decided, it's time to get working. So in April to September of 2021, we were looking at the pre-launch of our survey, specifically talking about the logistics, right? Revising the questions that Pennsylvania asked, right? Some of the questions were too specific or weren't questions that were specific enough for us or, right, weren't specific to our population here in Iowa. And then recruitment plans, right? How are we gonna get people to take our survey? Again, if you have questions about that, I'm happy to answer that at the end about how we got folks to be taking the survey. I'm sure you're all familiar with IRB approval and that fun process. And then obviously we also collaborated with the University of Northern Iowa, who did a lot of our data collection and cleaning up as well. So then on October 5th, our survey went live. We actually launched our event with a round of trivia. Again, getting in touch with the community. We went to a local gay bar in the Des Moines Metro and sponsored a round of trivia at this gay bar. It was a typically established event and said, let's have a round specifically looking at health equity. So asking questions to these groups of folks that were at this bar, right, to have a fun night and kind of depressing them with some of these questions, saying, hey, like on average, how many folks in Iowa are receiving testing for sexual health screenings and things such as that. So kind of getting folks to say, oh, these are some really wild things that are happening not only nationally, but also in our state, and maybe that's why I should take a survey. So that was a great, fun event. But then we also did a lot of other dissemination through prides, through word of mouth, through great networks such as the Iowa Cancer Consortium. Y'all are great. Thank you for that help there as well. But then we also obviously had some speed bumps and road bumps. We'll talk about those. But then ended our survey November 29th of 2021. And then we entered what was called kind of like what I call a waiting game, a long waiting game, if you will, to get the data that we received in June of this year from the University of Northern Iowa. So super excited to share with you all of these great findings, but obviously that brings us to today, right? When we're talking about dissemination and sharing of this information, I think you're all involved in that process with me as well. So when you read all of these fun numbers up here and you hear me talk about these findings, know that like you're also involved in this effort as well. Take these numbers back with you in your daily lives and use it in the work that you do. So, right, our dissemination protocols or our dissemination plan all involved a lot of steps. First and foremost, we disseminated through social media efforts and campaigns. So on the left of your screen there, you'll see what we used as some digital media to kind of get folks to get engaged via social media. We also did a lot of rural outreach. In the middle of your screen, you'll see what we called Pride in a Box. We sent these out in the fall of 2021. To specifically our rural communities. We found folks that had rural zip codes and on our mailing list, and in conjunction with Amera Group, we sent out these little Pride in a Boxes there. There was a great list of resources all about health, COVID, and all that other fun stuff that was going on at that time. And in the back of that box there, you'll see the "We need your help," asking folks to take our survey. Then we also did poster printing as well on the right of your screen. So we printed those out, put them in areas that we knew that LGBTQ folks throughout our state often frequented. So specifically talking about gay bars, talking about clinics as well that do sexual health screenings, and again, other areas that our community frequented. So, right, what did this survey entail, right? What did it all look at? It looked at a wide variety of areas. Obviously, because we were in conjunction with the Iowa Department of Public Health's Tobacco Division, we were looking at substance use, talking about drug, alcohol, and tobacco specifically, physical and mental health status, which include sexual health, experience utilizing health care programs or institutions in our state, cancer risks and screenings, which of course we will be talking about today, social support systems, demographics of the folks taking our survey, what does the population of LGBTQ folks actually look like, experience of discrimination and victimization. Again, you might be thinking, what does this have to do with cancer outcomes and things such as that? Actually, it has a lot to do with it. And then talking a little bit more about some specific areas, dental, mental, and vision health, status, access, and utilization. That was specifically given to us by the Des Moines University. They were hoping to do some focus groups around those areas there. So our characteristics of our survey, it took about 15 to 20 minutes to complete the survey. It was a lengthy survey, right? And because of that, we then incentivized the survey. And then we said, hey, thanks for taking the survey. Here's a $10 Amazon gift card, or you could be entered to win a $100 Visa gift card. So folks had those two options. It's also important to note that a majority of folks that took our survey chose not to receive an incentive. So that's an interesting thing to note, that usually when folks are taking a survey, they're just taking the survey because they want to. So good to note there. We had nearly 1,000 respondents. I think the correct number is about 860 something folks that took the survey. So we had a good number of folks that took the survey. It's also important to note that 86 of our 99 counties were represented in the survey. So One Iowa likes to say that that number is close enough for us to say there's LGBTQ folks in every county in this state. And so that being said, if you're interested in how to work with that community, reach out to us. But again, the survey itself was accessible in Spanish and English. We're hoping to even more so diversify the accessibility of our survey in the coming year. But right then, talking about demographics, who took our survey, to give you kind of the picture of who we're talking about when I give you statistics in a moment. But that being said, right, 1/4 of our respondents identified as non-binary or transgender. So that's important to note. Then talking about sexual orientation, I believe, yep. While a majority of folks did identify as gay, bisexual, lesbian, or queer, you'll notice also straight on there. A lot of folks say, how do straight people take a survey for LGBTQ folks? And I say, well, trans and non-binary folks can identify as straight. So that's always important to note there when looking at statistics. But then also talking about the age of folks, I think the median age was about 35, right? That was a large chunk of the folks that took our survey. But I always think it's super interesting, right? We had someone who was 87 take this survey, and our survey was entirely virtual. So shout out to an 87-year-old for doing that for us. But that being said, right, we also want to talk about race. We think it's super important at One Iowa to look at everything that we're talking about today with an intersectional lens. And that being said, right, race isn't the only intersection that we can be talking about. We also need to be talking about socioeconomic status, cultural backgrounds, citizenship, geographic background, all of that fun stuff as well. So that's why we're sharing this today. So that being said, right, the majority of Iowa is 91% actually white. We had 81% of folks report white on our survey. That being said, it's also safe to let you all know that younger generations are more likely than not to not identify as white. So might have something to do there because we had a younger population take our survey. But that being said, I also think it's important to note that we had higher margins for folks who were in marginalized populations take our survey. So specifically talking about the percentage of folks that identified as Black, the number of folks that identified as Native American or Indigenous, Asian, and all of those other things there. And then you can compare those to the numbers up top, right? We had an overrepresentation of folks who were of a different race other than white, which I'm very proud of us for doing. But along with that, right, some other key demographics to take away, 60% of our respondents had achieved an educational degree higher than an SHED or a GED, formerly called a GED. So it's important to note that that compared to Iowa is 6% higher. So our population is reporting higher levels of education. But that being said, right, 40% of our population reported not having a GED. And we know statistically folks who have lower levels of education have lower levels of accessing resources. So again, while 60% is a great number to be proud of, 40% is also a number to be looking at as well. Then 21% of our respondents reported living in a rural area, or community, and or farm. Iowa is 46% rural, I believe, based on the US Census defining our zip code, so that's important to note. And then nearly 20% of our respondents reported being Latin or Hispanic, and we contribute that great turnout of that community due to the accessibility, not only in Spanish, because we know not all Latin or Hispanic folks speak Spanish, but also just the great outreach that we had from y'all. So now let's get into the meat of this conversation, right? This is the stuff that I think you're all going to be excited to hear about, or maybe, right, interested to learn about. So these are the greatest disparities facing the LGBTQ population in Iowa based on the findings of our 2021 Health Needs Assessment. And these were all areas of health that One Iowa is now working towards addressing. So first and foremost, discrimination and violence. 41% of respondents reported being openly discriminated against in public, right? That's almost half of our population, only 6% shy of half to be exact. And that being said, right, if those respondents are being openly discriminated against due to their LGBTQ identity, you might be thinking, again, what does that have to do with our health outcomes? If I'm being openly discriminated against due to my identity, I'm more likely than not going to not disclose my identity to people in my future, right? So that being said, if I have a health advocate reaching out to me saying, hey, how can we take care of you today? I might not disclose, hey, I'm LGBTQ, right? Which is a very, very sad thing to notice. Thank you for saying that, as I did too. But then 36% of our respondents reported being forced into sexual intercourse. 36% of our respondents were victims of sexual violence. And again, you might be thinking, what does that have to do with anything? Again, higher levels of discrimination, higher levels of violence result in higher levels of negative coping mechanisms. So specifically talking about turning to drugs, alcohol, tobacco, right, due to discrimination. And again, 26% reported being forced into sexual acts within the last year. 20 reported this violence was explicitly occurring due to their LGBTQ identity. And I know this is really heavy stuff, right? But this is important to note because, again, all relates to our health outcomes. And then 37 reported being physically threatened and or harmed based on their LGBTQ identity. So, right, these numbers are all around like 40%. And that being said, right, if 40% of our population, again, this is all of respondents, this isn't a representative data set. We don't have enough folks to say that this was representative of all LGBTQ folks in Iowa, but that being said, if this is occurring with just a small group, it's probably going to be occurring with a larger group as well. So that being said, we know that these folks then probably are more likely than not going to disclose their LGBTQ status to their providers. And we'll talk about why that's important to know as a provider in a moment. This is a very brief slide, but we'll talk about why in a moment. But lack of access to healthcare, transgender Iowans, not only on this survey, but the last two surveys that were specific to the LGBTQ community reported driving over 1.5 hours to access inclusive medical care. That's a really long way to just go see a doctor, right? And that means, right, if I can't afford to drive, prices of gas are going up, right, or maybe I don't have a vehicle, I'm less likely to go see my doctor less often. So again, we were talking about folks that receive a diagnosis specifically around cancer, right? And then do they go back for treatment? It's safe to say, right, if I have to drive 1.5 hours, the answer to that would be no. I'm not going to go receive treatment regularly. Then nearly 20% of LGBTQ folks have been refused care, and that's inclusive of all medical services, including life-saving services. It's also important to note that a national survey done by Williams Institute of Law at UCLA reported 41% of LGBTQ folks in rural areas are being turned away. So it's safe to say that this number is probably heavily rural folks being turned away. Again, noting that rural areas have lower levels of income, resources, and education, so maybe not knowing about rights, things such as that manner. But that being said, right, if I go to my doctor, say, hey, you know what, I'm really scared. I've noticed, for example, if we're talking about breast cancer, I've noticed a lump on my chest, right? And I'd like to get it examined, and my doctor sees I have a pride bracelet on, and my doctor says, you know what, we're good. Yeah, I just heard that little oof, yeah, oof. So then lack of access to LGBTQ specific care, specific to our community, right, that we're talking about here. A lack of knowledge around sexual health needs for our LGBTQ populations. This is inclusive of PrEP and PEP, that's pre-exposure and post-exposure prophylactic. Those are two drugs that make the transmission of HIV virtually impossible. And then sexual health screenings are getting tested. 55% of our population reported being tested. It's also important to note that LGBTQ folks on average report higher rates of getting their sexual health screened when you compare them to heterosexual folks or folks that are not LGBTQ. So it's safe to say that if 55% of the LGBTQ population, again, it's important to note that this representative or this data set isn't representative of the entirety population in Iowa. But we can make broad assumptions right here in saying that 55% of our population that took the survey had ever been tested. It's safe to say that less than that in the heterosexual community has ever been tested or gotten their sexual health screened. And we know what all of that means, right, when we're talking about sexual health outcomes. You'll also notice I put an X over LGBTQ because, again, HIV or AIDS or HPV, right? Sexual health isn't just an LGBTQ thing. They affect all of us. So whether you're LGBTQ or not, you should be getting your sexual health screened. If you're sexually active, you should be on PrEP or PEP, right? Just to protect yourself. It also probably has a lot to do with the fact that Iowa has reported an increase in cases of syphilis and HIV in our state. So again, why there's an X over the specific LGBTQ patients. Then 45% of LGBTQ patients have had to educate their healthcare provider, 45% of our respondents have had to educate their healthcare provider about LGBTQ care. And that's inclusive of hormone replacement surgery, top or bottom surgery, pre and post-op care, or sexual health needs. And again, you might be thinking, what does that look like? That's like someone like me who doesn't have a medical degree going to a doctor and saying, hey, I'd love to start hormone replacement therapy, and my doctor saying, Malycki, I have no clue what you're talking about. And I say, Doc, don't worry, I've got you. I go home, do a Google search, come back and say, here's everything you need to know about hormone replacement therapy. Let's get started. I'm assuming most of you know that a doctor won't prescribe me hormones based on a Google search. So that being said, I might just say, you know what, I'm good. I'm not gonna go to a doctor anymore because my doctor can't care for me. What happens then? Drug, tobacco, and alcohol usage. 60% of our respondents reported utilizing tobacco or nicotine products in their lifetime, and then 75% of those respondents reported wanting to quit. So there's a desire from our population wanting to quit tobacco, but not having the resources, which is another great reason why we've partnered with the tobacco division of what is now IHHS to look at the health outcomes for our community and how we can get them those resources, right? If they want to quit, that's a step in not only tobacco control and prevention, but cancer prevention. Then 10% of respondents reported utilizing tranquilizers, 9% reported using inhalants, 8% reported using prescription drugs that were not prescribed to them. Again, a wide variety of health outcomes that can occur there, especially when we're talking about the different types of drugs being involved. But then 17% of respondents reported binge drinking at least once a week, 3 to 5 times. We define binge drinking as 3 to 5 times, or 3 to 5 drinks on more days of the week than not. So that's a range of 12 to 20 drinks in a week. That's a lot. Then mental health outcomes, right? How is my mental health doing? It's important to note, right, especially when we're talking about patients who might be receiving cancer care, mental health is a long, long thing and process to accomplish, right? To say that you're mentally healthy is an achievement, I would say, and especially in today's society post-COVID. But that being said, right, 50% of our respondents reported having considered suicide in their lifetime. 49% of respondents had reported seeking professional help for their mental health issues. And nearly 20% of respondents reported having seriously attempted suicide in the last year. And again, this is because of discrimination. This is because of lack of access to care, right? Again, this is important to know. But these are some other unique findings that we can take away from our survey. 66% of respondents reported having a primary health care doctor. Only 66% have a primary health care doctor, right? So that means that 34 of our respondents, 34% of our respondents reported not having a primary health care doctor. And that also contributes to what then? Not going regularly to the doctor for checkups, not having someone to turn to if I have, again, if I find something on my body that might be worrisome, such as a lump or bump, or I'm having other health complications. Then nearly 1 in 4 respondents reported having a health condition in their lifetime. 1 in 5 reported having 2 or more health conditions, and 2 in 3 reported having 3 or more health conditions in their lifetime. Health conditions are encompassing of mental health, physical health, sexual health, health, all of those things are encompassed there. But then specifically, right, 1 in 10 respondents in our survey reported receiving a cancer diagnosis in their lifetime. The leading results of that found that skin, breast, and colorectal cancers were those most reported by folks who took our survey. So then some other cancer specifics to know or note. Cancer in people living with HIV or AIDS is more likely to, or folks living with HIV or AIDS are most likely to encounter these types of cancer in their lifetime, specifically lung and anal cancers. Those have an asterisk next to them because, again, it's important to note that people living with HIV actually test at higher rates of receiving a diagnosis than folks who don't have HIV or AIDS. So again, important to note like that intersection there. If someone has HIV or AIDS, they're more likely to receive a diagnosis for lung or anal cancer. But then also important, liver cancer, colorectal cancer, and testicular cancer. Higher HIV folks also report higher rates of tobacco usage. And then, right, the misconception or miscommunication with, of, or for the trans and non-binary community also results in a lot of misinformation there. You'll see under there we have, if you've got it, check it. That's one of Iowa's favorite sayings that we have on some of our materials is, right, if folks are trans and non-binary, they most often sometimes don't know, right? If you have breasts and access of breast tissues, you should be receiving mammograms, right? So how do I tell a transgender man, hey, you should be receiving a mammogram, right? Some doctors just won't do that, right? They'll say, oh, if you're a man, you're good, right? Or, hey, a doctor will say that, and the patient will say, why do I have to do that, right? So important to know that we should be educating and communicating effectively with our trans and non-binary community there. But then, right, now that I've hit you with all of those depressing statistics and information, right, what can you do personally? So these are some recommendations here. You should be inclusive of LGBTQ specific care in doctoral education. So if you're involved in the educating of health professionals, you have to be talking about that intersectional lens, not just LGBTQ folks, but how can you also effectively care for folks of different race, ethnicities, cultures, and backgrounds. If you're not talking about that in a classroom that's talking about medical health, in my mind, maybe you should reevaluate that. You should also decrease misinformation. Education through trainings or presentations, such as those occurring today, are a great way to take that information that you've learned and take it back to your own communities, right? Take what you're learning today, take this information into your own community saying, hey, let's look at this, right? Or, hey, we've never talked about this before and we have work to do. Then an increase in funding for DEI efforts in Iowa's healthcare systems. And this is specifically talking about bridging the gap between the religiously affiliated hospitals and the LGBTQ community. Most oftentimes in our community, there's a distaste for religion or religious discourse. But that being said, there's more often than not an open door for us, right? And so how do we bridge that gap? How do we tell LGBTQ folks, hey, this space is safe for you and you're invited in and we will care for you effectively, right? So that comes about with education and DEI efforts. But then also an increase of resources in rural areas. I'm sure this is all something we talk about daily. How do we do that, right? It's a lot of work. Some other things that you can do: educate community and providers that maybe are in your network, right? If you're no longer maybe going to a doctoral school or receiving your doctoral degree, right? You might be saying, hey, there's doctors that I work with that aren't competent on LGBTQ issues, right? So here's how we can educate. Then sharing this data from our survey. I'll provide you all with a link to that survey as well so you can have access to it in the slides. But then also support One Iowa efforts, specifically talking about our LGBTQ specific community. If you're looking to support us that way. Support the future of the survey. 2023 and on, we're hoping hoping to have this survey go live every other year. So that means not 2022, but in this next year, we're hoping to have another surveying of our population. So we would love to have you all involved with that. If you're wondering how to do that, stay in touch with One Iowa, stay in touch with the Iowa Cancer Consortium, because we have a great relationship there and rely heavily on you all to help us with the work that we do. But then also some best tips or practices for you all, now that you know all this information, that you can take back today and implement in your daily lives, right? Instead of having to reach out to us directly, you can be updating your intake form, so you should be soliciting information, specifically asking legal name, then correct name, legal sex, gender identity, and letting folks fill that in a blank, then asking pronouns, but not asking folks for their preferred pronouns, right? Their gender identity is not a preference, it's who they are. So just asking for someone's pronouns. Then also making sure that we're helping manage dysphoria in care, specifically talking around gender dysphoria and sexual dysphoria that occurs most often with our LGBTQ population. So using correct anatomical terminology, right? I've heard some great folks already come up here and talk and use correct terminology, right? Using the correct anatomical terminology. For those of us who might not be doctors working in offices, right? Or working in like the specific room with a patient, we might not know, right, how to do this, right? Hopefully we're all adult and can handle saying, hey, we're talking about prostate cancer, right? Instead of saying a men's cancer screening, right? Because when we're talking about our trans and non-binary folks, women can have prostates. Then also, right, I think this is a pretty standard thing. I think this is something we should do even without someone being LGBTQ, and I think Dr. Richardson also talked about this a little bit. We should be explaining screenings thoroughly and check in to answer patient questions, right? If we don't tell someone, hey, I need you to see you next week and here's why, someone probably won't come back. Then also offer breaks if needed, right? And include LGBTQ pamphlets in your waiting rooms or just even on your website. It's actually proven that if you provide LGBTQ literature in your wait rooms, LGBTQ folks are more likely to disclose their LGBTQ identities to their providers. So just something to think about there as well. Then I want to provide you all with some resources that you can take away and utilize to continue doing your own research. So some state-specific to Iowa, One Iowa's resources there, but then also the University of Iowa Carver School of Medicine has a great resource as well for you all to utilize. They have a plethora of resources, and we actually work with them diligently to make sure that we're providing care effectively for the LGBTQ population. Then some national resources for you all, right? I've already shouted out the LGBTQ National Cancer Network. I love the folks at the LGBTQ National Cancer Network, and I hope you all will too when you reach out to them. Please do that. They're very passionate about what they do and can help you when you're looking to educate and continue growing. The Willans Institute of Law at UCLA, also a great group of folks. If you have ever had the opportunity to connect with them, they do a large majority of research for the LGBTQ population, so please reach out to them. Then also, right, the Human Rights Campaign working towards the LGBTQ community for advocacy in our LGBTQ community nationally, and then obviously, right, just the National Cancer Network as well, another great resource for you all to utilize. But that being said, I want to thank you all for having me here today and talk to you all a little bit specifically about the LGBTQ community and the disparities that we face. Feel free to reach out to me if you have any questions in the line of work that you do, or even keep me in your back pocket as a resource if anything comes up in the future. Thanks, y'all.
Malycki, thank you so much. Thank you so much. And we do have about 5 minutes for questions if anyone has questions. I know you have questions.
You said of the 66% of the respondents reported having primary care doctors. Are those people that disclosed their identity or to them, or is this just in general?
That was just in general, right? So that 60% isn't promising that their doctors know that they're LGBTQ. Good question.
Did your survey ask anything about like protective factors, like supportive families, or was that kind of outside of the scope?
Yeah, we actually did ask questions about support systems, specifically asking folks, do they have support systems at home? Do they have individuals that they can turn to, not specifically like medical or healthcare providers? So we did ask that, and you can get specific data around that in our findings that I provided to you all earlier on in our session there. But I believe the number of folks that reported having a supportive system was about 60% of the respondents.
Good morning and thank you. When I looked at the demographic slides that you had, did you go any deeper as to the geographic areas that these people are located, whether it be rural or in larger cities?
Yeah, so I believe the number that I shared was 21% reported being in rural communities or living on a farm, and we did that all by population and zip code. So folks didn't always have to put in their zip code, they had the option to, or they could select where they lived based on population of their city or wherever they might be if they're living on a farm. So does that answer your question effectively?
Population slide, and if there was opportunity for resources in certain areas of counties or in the state where you saw some overlap of needs based on those zip codes.
Yeah, those weren't published in our findings specifically, in our findings document, but those are things that we have and are hoping to utilize. The University of Northern Iowa houses all of that just to keep LGBTQ folks safe. We decided that we weren't going to share out the information where LGBTQ folks specifically are in our state, especially when we have high levels of discrimination and violence towards our community. But we do have that, so if you yourself are a professional looking at, hey, what are the respondents in my county looking at, or who are the respondents in my county and what are they experiencing, please reach out to us because we can get you that information. We just don't have that in our findings to keep LGBTQ folks safe. Yep.
Other questions? All right, let's give Malycki one more round of applause.
Thank you.